Hello, good evening everyone, and welcome to 365 Live. My name is Kamin and I will be the host for tonight's live session. 365 Live is a platform where we educate the public on cancer and encourage a cancer prevention lifestyle. So whenever you see this logo, you'll know that 365 Cancer Prevention Society is currently having a live broadcast. So for tonight's talk on gastric cancer, Risk Science Prevention and Management is brought to you by Dr. Tan Hon Lin, Senior Medical Oncologist at OncoCare Cancer Centre. 365 Cancer Prevention Society has been committed to serving the community through holistic cancer prevention measures since 2003. This is accomplished through health and nutrition education, the promotion of a healthy lifestyle, and our 365 rhythmic stretching exercise. We also provide practical and emotional support and care for our clients and their family members in their battle against cancer through our residential and hospital visitations, counseling services, nutrition consultation, and wellness services. So please like, share, and follow us on our social media pages for the latest updates on our events and activities. So 365 Cancer Prevention Society has been championing early detection, which is why we have introduced a series of free screening campaigns that empower individuals to proactively take steps towards early detection and a healthier future. We have now got 3 cancer screening campaigns that are currently ongoing: the gastric cancer, lung cancer, and a multi-cancer screening. You may scan the QR code on the screen now and check out our website for more details and for registration. Let's encourage our loved ones to take care of their health and sign up for the screening today. So please take some time to scan the QR code. And if you are keen to help us bridge the gap and donate to help fund our screening campaigns, please feel free to take out your phones and scan the QR code to donate. Your donation will help individuals in need have a chance at early detection. Also, a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. Do consult the doctor for personalized and detailed medical advice. So without further ado, I'm pleased to introduce tonight's speaker, Dr. Tan Hon Lin, Senior Medical Oncologist, OncoCare Cancer Centre. So she's here tonight to share with us all about gastric cancer and its risks, science, prevention, and management. So if you have any questions, please feel free to post them in the chat and Dr. Tan will actually address your questions during the Q&A session later. Hello, good evening, Dr. Tan.
Hi, good evening, Kamin. Thank you for the introduction to this evening's talk.
Thank
Good
you
evening.
for joining us tonight to share with us your knowledge. Yeah, so without further ado, let me hand you the time so that you can have your sharing. Thank you.
Thank you very much. Good evening, everyone. Appreciate that you're taking this time off to understand this topic a little bit more. Well, today I hope to help you understand gastric cancer better. We will discuss risk factors, early signs and symptoms, prevention, as well as management of this condition. So let's start by understanding the basics. Cancer is a condition or a disease where cells divide and grow in an abnormal way. There are different types of cancer that can grow in the stomach, with the most common type called adenocarcinoma, which begins in the glandular cells of the stomach's inner lining. This is what we usually refer to when we use the term gastric cancer. Less common types of cancer that can grow in the stomach include GIST, short for gastrointestinal stromal tumors, lymphomas, neuroendocrine tumors, and others. The cancer may spread along the stomach wall or grow through the wall and also spread through the bloodstream or lymphatic system to other organs. Across the world, gastric cancer is the 5th most common cancer and the 5th leading cause of cancer death as of 2022. The highest incidence rates are seen in Eastern Asia, in particular countries like Mongolia, Japan, South Korea, and China. In Singapore, it's the 7th most common cancer in men and 9th most common cancer in women, causing about 300 deaths per year in Singapore. So what are the risk factors that can lead to a higher risk of gastric cancer? Some of them we cannot change, like age. We see most cases occurring after age 50, with the peak incidence between 60 to 80 years. Although there are patients diagnosed younger, that is still less common. And then gender, we see that men are 2 to 3 times more likely than women to develop gastric cancer. And family history, a small percentage of cases, about 10%, have a familial link. Having a first degree relative with gastric cancer does increase the risk, not necessarily only if there is already an established or known hereditary condition. And then importantly for tonight, we need to know that there are risk factors that we can change or modify. Among them, H. pylori infection is a significant risk factor for developing gastric cancer. H. pylori is a type of bacteria that can cause chronic inflammation, ulcers, eventually leading to changes in the stomach lining, becoming cancer. An unhealthy diet high in salted, smoked, or processed foods, smoking, obesity, heavy alcohol use are things that we can look at to see how we may then reduce our risk. So the good news is that there are risk factors that we can try to avoid and have a positive impact on our health. For example, if we have H. pylori infection, having it treated with antibiotics and gastric medications is effective. We can eat more healthily, having a high fruit and vegetable diet, having less salty and processed or preserved foods. Certainly, avoiding smoking and alcohol can help with this, among other health benefits. And in the end, regular exercise and maintaining a healthy weight is also helpful. So a lot of people ask, how do I know if I might have gastric cancer or not? There are many symptoms that could possibly suggest a problem. For example, upper tummy pain or persistent indigestion, the feeling of heartburn, bloating, not being able to eat as much as before, or losing appetite and weight without intending to. And then more obviously or seriously, passing black stool or having obvious bleeding, recurrent nausea and vomiting, or feeling very tired, giddy, etc. So a lot of these symptoms are somewhat common. They may not necessarily mean cancer, but maybe as a ballpark, if you have these symptoms, for example, for more than 2 weeks, do get yourself evaluated. If you do have some of these symptoms, like the black stool, bleeding, or more pain, do not wait. Go seek a consult to see what the problem might be. Gastric cancer does not typically cause symptoms during the early stages. So most oftentimes we may see unexplained weight loss or stomach pain. In the end, if we do have something unexplained, do seek medical attention early for us to find out and help. So how do we then get to the diagnosis of gastric cancer? Well, there are many tests that people do when we do have symptoms, but in the end, the definitive test that we do to have a diagnosis would be an endoscopy, which is a small camera inserted through the mouth to view. First, they will go through the swallowing pipe and then the stomach and the first part of the small intestine. And then if there are abnormal areas, biopsies are taken. Biopsies means taking a small tissue sample, which we send to the lab to look under the microscope, to look for abnormal cells. Other than identifying abnormal cells, cancer cells, or precancerous activity, it sometimes also can tell us about infections. The procedure itself isn't all that scary. It's done fairly commonly, many times outpatient. It's usually done with some sedation, meaning you're given medications to be comfortable, a little sleepy, so that it is not uncomfortable. And in the end, it's a fairly quick procedure, oftentimes less than half an hour, with some rest before and after the procedure to ensure you are well before sending you home. Upon diagnosing that there is a cancerous growth, and then we want to know if there might be other areas that are affected, and so scans are done. They could be CT scan. In some cases, you might have heard of PET scans being done. It is to check for the extent of the disease, if there is any spread. On the right are just some pictures. These are CT scans where you can see there is a bubble with some fluid inside, and then some medications are given to expand the stomach so that we can look at the lining of the stomach a little better. But this is still not as good as looking directly through the camera on the scope, as mentioned earlier, if we want to look into the stomach lining. Now, upon diagnosis, I would now like to share a little bit about what management is should we have a diagnosis of gastric cancer. There are many considerations when we treat a patient, and it's not just a patient-doctor relationship. There are many different doctors involved. We have many other colleagues that we require working together with, our nurses, dietitian, social worker, as well as working together with the family members or caregivers in this whole process. When we think about treatment of a particular cancer, we often look at a few things. We look at the cancer, where the cancer is, whether it has just remained in the lining of the stomach, or is it thicker, has it gone to surrounding lymph nodes or other organs. We also want to know in, for example, more advanced cancers, are there particular markers of the type of cancer that may guide different types of treatment? And importantly, we need to know the patient's overall health so that we can adjust treatment and give recommendations accordingly. There are many ways to treat gastric cancer. Some patients may receive more than one type of treatments. For example, surgery or procedures through the scope, radiation therapy or chemotherapy. And every patient should receive good advice and care in terms of nutrition, maintaining physiotherapy, as well as psycho-emotional support. In terms of endoscopy and surgical procedures, it really depends on where and how much the cancer has affected us. Endoscopic procedure basically means using the same small camera and very small tools, specialized instruments through the scope to allow us to do certain procedures like removing very early areas of abnormal growth. And sometimes this is sufficient in very early cancers to remove, or precancerous conditions where we can remove it altogether. And then we have keyhole surgeries where instead of making a long cut down the tummy, we have small keyholes with cameras and instruments inserted through the different, we call them ports, in order to allow us to do procedures without a big cut. And air is inserted into the tummy to give us more space to do the procedures that we have to. And then we have open surgeries, which we still do to achieve effective outcomes. And your surgeon doctors will be the ones advising on which sort of procedures are most ideal for you. In terms of procedures, when we do keyhole surgery or open surgery, our aim really is to try to remove cancer completely. But sometimes procedures may be done, for example, to insert tubes or to do bypass procedures, and the medical team will be there to explain the purpose of each treatment. People often ask, hey, if my stomach is missing, can I still eat? How do we survive? Actually, there are many patients who may have just part of the stomach removed. Some patients have the whole stomach removed, but they're still able to take food, perhaps with modifications such as small, frequent meals, Sometimes if parts of the stomach are missing and unable to absorb regular vitamins through regular diet, then there'll be additional vitamin supplements that your medical team would advise on. And patients are still able to maintain healthy weight and stay active, just like in this newspaper article that is on this slide presently. Now, some patients require, besides surgery procedures, treatment like radiation therapy. Radiation therapy refers to using high energy waves to kill off cancer cells, and this can be done as treatment on its own. Sometimes we give it together with chemotherapy, and the term will be chemoradiation. And how this is done, the radiation doctors will do planning before treatment is administered. They will figure out the dose and where to target the radiation therapy to, because it is, after all, fairly localized treatment. Each treatment takes a fairly short time, and a lot of patients ask, if I go for radiation therapy, does this mean that I'm radioactive for those days that I've gone for treatment? That is not the case, yeah. And in the end, this radiation therapy can be used as treatment for many purposes. Sometimes it can be done before or after surgery to shrink tumors or prevent recurrence, or it could be used to ease symptoms from advanced cancer, such as, for example, if there might be bleeding or if there are other areas that are having areas of pain, radiation therapy can be helpful. And then we also have chemotherapy. And when we say chemotherapy, it is a broad term referring to medications that are aimed to destroy cancer cells. And it could be one drug or a combination of a few drugs given together with the same purpose. Again, chemotherapy can be given before surgery to shrink the cancer, could be given after surgery to reduce relapse, or it could be the main treatment in cases of advanced cancer, either alone as traditional chemo drugs or with targeted therapy or immunotherapy that I'll briefly speak about shortly. These medications are often given by drip, sometimes just through a plug in the hand that you might be familiar with. Sometimes some medications need to be given directly into bigger veins, either through a little port or button under the chest, or sometimes a line in the arm. And then there are some medications that are oral pills. Oftentimes, though, oral pills may be used in combination with drip medications as well. A lot of times people ask, chemotherapy sounds so scary. Am I going to lose my hair? Am I going to vomit? Am I going to be sick for the whole time that I'm on treatment for several months? Not all chemotherapy have the same side effects. For example, some medications indeed do cause hair loss, but there's also a fair number of medications that don't. And your doctor will advise on what are the specific side effects of chemotherapy to look out for. And certainly there will be advice on how to manage these side effects. There are certain side effects that are more peculiar to the type of medications that we use for gastric cancer. For example, numbness in the hands and the toes, being more sensitive to the cold, or having blisters over the hands and the feet. Whatever the case, there will always be a clear discussion on what to look out for and what to do should there be any discomfort or potential side effects that our patients face. You might have heard of the term targeted therapy. In the end, targeted therapy is meant to try to target cancer cells more specifically, trying to be effective in killing the cancer cells while reducing the side effects on other normal cells. Targeted therapy for gastric cancer, there are a few different types, and there are different targets, and there are new ones that we are discovering over time. And how do we know if some targeted drugs may be suitable. The tumor samples that we have can be sent to check for certain abnormalities or certain proteins, and then we see if particular targeted drugs are then suitable. And then there are other types of targeted medications that may be a little bit more general, for example, targeting blood vessel such that we can be more effective in treating the cancer when used in combination with chemotherapy. And then immunotherapy has been a topic that's been increasingly spoken about in recent years. An important part of the immune system is its ability to keep itself from attacking normal cells in our body. And sometimes cancer cells escape our immune system by hiding. And immunotherapy mainly aims to try to use our immune system to look for these cancer cells and target them such that we can attack the cancer cells and keep it under control. Again, in many situations, we will look at various factors or characteristics of the tumor and advise on how immunotherapy can be helpful, particularly in advanced stomach cancer at this point. There are many clinical trials ongoing to see how immunotherapy can be given alone or in combination with other treatment, and perhaps it could be increasingly used in other situations as well. Immunotherapy sounds very attractive because you may have heard of many patients being on it for months, sometimes even short years. But we must know that every medication has potential side effects, and immunotherapy is interesting in that the side effects can sometimes be a little less predictable. It could occur early on, right after starting. It could occur a couple of weeks to months later. And sometimes we even see side effects showing up after we finish treatment. And it is part of how our immune system is responding to the treatment and what's going on in our body. Many of the side effects are treatable, for example, with steroids to reduce inflammation or other medications to also help with an overactive immune system. But in the end, it is important to understand that every medication has potential side effects that can be serious and sometimes even life-threatening, especially if we leave it untreated. So in the end, there are many various ways and treatments available when we speak about gastric cancer and its potential complications. I would like to address some take-home messages, and one of them would be that gastric cancer is actually not all that rare in Singapore, as we discussed. The risk does increase with age, particularly after 50, 60 years old. It may sound scary, but what's great is that we can take steps to reduce our risk. For example, maintaining a healthy diet with more fruit and vegetable, less salty, less processed foods, and importantly, treating H. pylori infections if we have a diagnosis of it, and then maintaining a healthy exercise regime and a healthy body weight helps in many conditions. And then early detection saves lives. Gastric cancer can often be cured if found early. Screening or checkups are important for people with risk factors we discussed earlier. For example, family history, and really important to go for checkup if we have persistent stomach symptoms, generally feeling unwell, or the red flags that we spoke about earlier. And even if the cancer may be found in more advanced stages, well, in some situations, we cannot completely cure the cancer. Treatment can help, and there are many effective therapies to control cancer, relieve symptoms, and supportive care is available from many different aspects to improve quality of life. Awareness is important, And that's also part of a big reason why we are having this discussion today, to know what to look out for, when to seek medical attention, and it is important not to ignore persistent symptoms and to have your questions answered if you have any. So thank you very much for your time, and I'll hand the time back over to Kamin.
Thank you, Dr. Tan, for your informative sharing. I've indeed learned a lot about the risk, science, prevention, and management of gastric cancer. And also for those who have just tuned in or just tuned in halfway, if you have any questions, please feel free to share them in the comments, and we'll invite Dr. Tan to address them accordingly. And also a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. So do consult your doctor for personalized and detailed medical advice. So maybe to start the ball rolling, okay, maybe I can first ask Dr. Tan, can I trouble you to share more, is gastric cancer and stomach cancer the same thing?
So, stomach refers to the organ, yeah, that we have between the food pipe and the small intestine. When we talk about gastric cancer, a lot of times we are referring to gastric adenocarcinoma, okay, and that refers to cancer that's arising from the innermost layer of the stomach. There are other cancers that can arise in the stomach, for example, gastrointestinal tumors. And when we say GIST, okay, that sort of tumors can occur in different parts of the body. For example, it could be a gastric GIST, meaning that sort of tumor that arises from the stomach, or it could be, for example, a rectum GIST that arises from that part. So in the end, we often use the words gastric and stomach quite interchangeably. For today's discussion, the main topic would be the most common type of gastric cancer that we see, gastric adenocarcinoma.
Okay, I see. Okay, so talking about gastric cancer, right? I'm sure maybe some audience would like to may have this concern. So if they have a common occurrence of gastric pain, so does it mean that he or she has a higher risk of gastric cancer?
Not necessarily. Gastric pains can be due to many different causes. One of the most common reasons we have gastric discomfort would be gastritis, and there are many reasons for that. Usually, we really want to know if there is, for example, H. pylori or bacterial infection. An H. pylori bacterial infection can increase the risk of us developing inflammation, stomach ulcers that can also cause that discomfort, and then, of course, moving on, stomach cancer. So when we have tummy pain, besides the stomach, in that region, things that can cause discomfort would be, for example, the gallbladder. And other conditions can make us feel ill. So in the end, just having tummy pain alone is somewhat non-specific, and you would need to have your doctor sit with you, try to understand your symptoms a bit better, and move on to have some tests or trial of medications to see if they can be effective in reducing this discomfort that you're experiencing.
So not necessarily having discomfort in the stomach area means that the person is at a higher risk of gastric cancer. Okay.
That's right.
Yes. Okay.
Yeah.
Okay. We have a question from Alicia. What advice would you give to families or caregivers supporting a loved one with gastric cancer?
So, well, it is certainly not easy to manage with the diagnosis of gastric cancer, not to mention needing to also manage the treatment, the logistics. So we have so many aspects to think about. Other than patients themselves physically feeling unwell, there is a lot of emotions that we will also have to manage. Recovery, I will not deny, can be challenging, but it's certainly possible. There are many different aspects besides physical support, physical health, nutritional support. Mental health is also important. And in the end, we hope that all our patients may live comfortably during and after treatment. And during these difficult times, the medical team, support groups like Cancer 365, and other supporting groups can be very helpful in rallying together to give, besides just advice, practical help.
Yes, indeed. So other than the pain that the patient is undergoing, there are indeed a lot of emotions that and also a lot of thoughts that goes through the patient during this difficult time. Yeah. So indeed a lot of support is definitely needed for us to support the patient through this journey. So may I ask Dr. Tan, okay, since we are talking about this one, okay, may I ask Dr. Tan this one? Oh, okay, sorry. Just I want to ask, okay, a question came in by Celeste, sorry. Will frequent stomach reflux lead to gastric cancer?
So that's interesting and also partly related to one of the risk factors we spoke about earlier, which is obesity. We tend to see this a bit more, perhaps more, in the Western population. Certainly, with more reflux means irritation to the normal stomach lining. Reflux tends to affect the lower part of our esophagus or the food pipe and the first part of the stomach. And we've seen that in patients who may have higher risk of reflux or obesity leading to reflux, there can be abnormal changes in the cells in that area. And those abnormal cells or abnormal changes can sometimes become precancerous, and if we leave it be over time, become cancerous. So there is this term called Barrett's esophagus. It might be something that you come across in your reading, that if we were to diagnose it when we do a scope, sometimes patients may need to return earlier for repeat evaluation and of course continue treatment and follow up with their doctors just to see that things are well controlled over time.
Okay, so obesity may lead to reflux. Okay.
Well, that's one, and there are other reasons for reflux too. It doesn't necessarily lead to gastric cancer, but certainly as reflux itself is an uncomfortable
Yes.
condition, and it can be managed. So certainly do seek help for managing reflux to prevent discomfort and further complications.
Okay, and just as we were speaking, we have a question from Ming Hui. It's asking, can colorectal cancer testing be used for screening of gastric cancer since black tools contains blood? Yeah.
So why do we say look out for black stool? It's
Mm.
because if there are areas of bleeding, blood as it goes through the digestive system changes color. It's like iron, and then it becomes black or dark. So the FIT test or the stool occult blood test mainly is trying to look for small traces of blood. And when it is positive, it's been shown to be it's when it's positive, it's been shown that it could be related to underlying abnormalities in the large intestine. And yes, we have had patients where they also have a positive finding of traces of blood in the stool, and their colonoscopy was okay, but we saw that there were problems in the stomach as well. But this test is not designed to be a screening test for gastric cancer. It was designed to be a screening test for colorectal cancer. But certainly, if there are traces of blood seen, then your doctor will evaluate and advise on what next steps to do, what scopes are recommended, and how to follow up. If you are passing black stool, then that is already an need or an indication, we say, for scope to see what areas of bleeding there can be, because it doesn't mean passing black stool equals gastric cancer. There are other reasons for bleeding. For example, sometimes it is due to ulcers, and these are all treatable.
So talking about signs, the signs. So there's a question by Daphne. So she's asking, what's the first signs of gastric cancer? I think you have mentioned earlier on in your sharing.
Mm. So earlier on we mentioned that unfortunately gastric cancer symptoms can be fairly non-specific. For some
Mm.
patients, it could be just discomfort or gastric pain. For some other patients, when things become more advanced, they have poorer appetite, maybe difficulty swallowing, or feeling full very easily, or getting bloated. And for some patients that might have bleeding that isn't obvious to the naked eyes, sometimes they start to get more tired as they are slowly losing blood that you can't see with the eye, but generally becoming what we call anemic, where the red blood cell count is low. So unfortunately, there isn't a one first sign that can tell us that a patient has gastric cancer.
Okay, sure, sure. So as what Dr. Tan has mentioned, early detection saves lives. So once we see that there's something not so right, maybe we can start to uh, go for screenings and check. So here comes a question as a follow up. So at what age or under what circumstances should someone consider regular gastric cancer screening?
So it's interesting because there are some countries where the incidence of gastric cancer is high. For example, in Japan or Korea, where they have a national screening program. Well, in Singapore, it is still a significant issue. Yeah, the incidence is not as high, and therefore we don't have a national screening program. Like for colorectal cancer, you might have heard we encourage patients from 50 years old onwards to go for screening. Well, presently, our screening would be prioritized to patients that may have higher risk. For example, high risk groups would include people with a family history of cancer, individuals infected with H. pylori bacteria, and generally older adults over 50. Certainly, those patients, the very small group who know that they have family members with hereditary conditions resulting in the gastric cancer, they will need regular follow up. So our focus in Singapore really is on identifying high-risk patients rather than screening the general population and alerting that it is important for us to understand and be aware of symptoms to look out for, to seek medical attention, and also importantly, our healthcare system plays a very strong emphasis on prevention. For example, like tonight's talk, where we talk about how we can try to reduce our risk by modifying our lifestyle factors, like modifying our diet to be more healthy, to avoid things that could irritate the stomach or cause changes in the stomach lining, resulting in changes that can become cancer over time, smoking or excessive drinking.
Yes, indeed. So, like what Dr. Tan has mentioned, uh, there is treatment available. Awareness is key. And a gentle reminder for those who have just tuned in or just joined us halfway, if you have any questions, please feel free to share them in the comments and we will invite Dr. Tan to share them accordingly. I see we have a question by Sheila. So she's mentioned she had stomach inflammation and started taking some medicine.
Promoted.
Yeah. And she's checking if she can stop this medicine after 8 days as she has no more stomach discomfort. Not sure whether Dr. Tan can give any advice.
Well, I think it's tough for me to say
Mm.
because I am not so certain of all your symptoms and current condition. But it would be useful that you do check in with your doctor to figure out, what is it that caused your discomfort in the stomach and the recommended duration of treatment that your doctor had prescribed you.
And yes, so a gentle reminder that all information shared at this talk is actually for general information only. So please consult your doctor for personalized and detailed medical advice. Yes. And moving on, Okay, there's a question by Yifeng. Rashes appearing on stomach or limbs, has it has any relations to gastric cancer?
Off the top of my head, generally no. Yeah, if there are, I mean, there are very rare conditions where sometimes some rashes could be related to an underlying cancer, but that wouldn't be the first thing we think about commonly. So if you do have rashes or any symptoms that are bothering you, please do go seek some medical attention to see what's causing the rashes and how your doctor can help you be relieved from it.
Yes. Okay, we have a question from Alicia. So, if someone needs to take over the counter gastric medication frequently, does it signal a more serious underlying condition that should be checked out? So, at what point should they go for further investigation or screening?
So we shouldn't be having discomfort that's persistent or recurrent. So certainly, if you are frequently feeling discomfort or unwell, then you really should have a discussion with your doctor on the next steps to take. And of course, your doctor will be asking you as well if there are other symptoms, such as how your oral intake's been, looking at your weight pattern, as well as other accompanying symptoms. And in the end, anyone who needs to be regularly seeking medications should get more advice to understand if there is something underlying that we could address effectively, and also in case there could be something more sinister or not, the doctor can advise on the risk and the next steps to take.
Oh, I wanted to ask Dr. Tan, does spicy or raw food increase the risk of gastric cancer?
So in general, there hasn't been very clear correlationship between spicy food. I mean, we all love our mala, our curries, and our tom yum. Yeah, yeah. So spicy food, and what was your second question? Spicy or?
Spicy or raw food?
Well, raw food itself, not exactly. Earlier on, we spoke about this particular infection called H. pylori. It's not directly associated with raw food. Oftentimes, we do feel that this bacteria could be transmitted from person to person. Actually, it's a very common infection, particularly in developing countries, but not directly related. It's not associated directly with raw foods.
And talking about food, we have a question by Michelle. So she's actually checking, will honey or cinnamon help to ease gastritis?
Mm, well, not particularly or directly. The gastritis could be due to a variety of reasons. The question would be, is it due to an infection, which will require effective treatment with antibiotics and gastric medications? Is it due to some people with perhaps with alcohol intake can have what we call alcoholic gastritis, and the treatment would be supportive protective medications, and of course cessation of uh, drinking. And then there are other types of gastritis that sometimes are less common, but we do see them. They are, for example, autoimmune gastritis. And these are all different conditions that we have various methods to try to manage and treat. While honey and cinnamon, for some patients, they may feel better after having a nice warm drink. It probably doesn't directly address the underlying problem. So do go see how we can figure out what the underlying reason for gastritis is and the appropriate treatment.
Definitely. So different conditions have different treatments to manage. So we definitely have to seek medical advice on this. Yes. And we have a question from Connie. So she's asking whether would H. pylori spread to family members.
So H. pylori is a bacterial infection, and it is common, and we especially see clustering, meaning we often do see it happening perhaps in families or in close contact. And the thought or theory behind it is that close contact or household transmission is common. Yeah, so if someone in your family does have H. pylori, it would be sensible to be aware of symptoms like stomach discomfort, bloating, and do consider getting tested if symptoms arise.
Okay, so close contact may be transmitted.
Well, in the end, it is possible. We do see clustering, we do see family members that
Okay.
sometimes come to us and the family member also may have H. pylori infection. Not necessarily so, but it is possible. And in the end, H. pylori infection is a very common condition and infection that we have and very treatable. And the treatment is with gastric medications and a course or combination of antibiotics. And it's actually very effective in terms of eradicating or actually treating the underlying infection in up to 80% or more if we are actually compliant or keeping to the treatment course that your doctor has prescribed.
Okay. Okay. May I check with
Even
Dr. Tan?
share a little bit more about H. pylori. Yeah, I think the what we have noticed is that the rates of infection generally seems to have decreased over the years, possibly relating to how we have been getting treatment. Yeah, the use of antibiotics, perhaps better hygiene, better living standards. Yeah, and there are other countries, particularly developing countries, where sometimes we see much higher rates, and it could be related to access to treatment or awareness and getting treatment for it. That doesn't allow the rates to come down as quickly as it has for Singapore in the recent decades.
I see. Okay. Wanted to check with Dr. Tan. So, is it true that sugar feeds cancer? So, will avoiding sugar help to reduce the risk of getting gastric cancer? I think this could be a question that's on top of some of our audience mind.
No, so sugar doesn't, how to say, it doesn't mean that sugar feeds cancer in a way that it causes or worsens cancer directly. However, excessive sugar intake can lead to issues like obesity and other problems that in turn become a risk factor for certain cancers. So everything in moderation, really.
Okay, so obesity is a risk factor for
Yes.
cancer.
And
Yes.
other than obesity being a risk factor for certain cancers, it is also a risk factor for many important medical issues such as heart disease, stroke disease, diabetes, and some of them are just quite interlinked. And if we are able to lead healthy lifestyles, have a healthy diet, might not be so easy, especially with convenience foods or some people associating sweet, sugary foods as being very yummy, understandably. It's not easy, but if we can take small steps to start with, yeah, to start trying to have a healthier diet, a healthier weight, maintaining it, all this can be very helpful for our general health, not just in terms of cancer.
So indeed, leading a healthy lifestyle, taking small steps to have a healthier weight is very important. Yes. Okay. Okay. Maybe just a few more questions. Can people with gastric cancer resume their normal daily life after treatment, Dr. Tan?
Well, most of the time, it is really tough in the recovery period. I will not deny that. But then again, I also see so many patients that they tolerate their treatment well. They are well supported during that time from their friends, families, and medical team to ensure that their treatment has as little impact on their physical self as well as their quality of life as much as possible. A lot of patients worry that after surgery, they are not able to eat. They may need to have very special diets or maybe even tube feeding, but really depending on each patient's condition. Even after major surgeries like stomach surgery, where part of the stomach is removed or the whole stomach is removed, many patients are able to take by mouth. Of course, some patients, they may be more special and they may require feeds through tubes. But by and large, our aim really is to try to see if our patients can eat naturally, sometimes with food modifications, like making it softer or having higher nutrition, having more nutrition packed into whatever we are eating to try to maintain enough nutrition, calorie intake, hydration, such that at least physically our patients are doing well. And then patients also worry that, hey, with chemotherapy, earlier on you mentioned that there are all these side effects. Are they going to be long term and affect us from not being able to function or live a life? Many of the side effects occur during treatment. Some side effects do linger on longer, although during treatment you're closely monitored by your medical team, the doctors, the nurses, our allied health, to try to reduce these side effects from impacting your quality of life and regular function. So in the end, if there are side effects, we try to address them early, we try to manage them, and try to avoid these from affecting your function, your roles as in the workplace, your roles in your families, and among your friends.
All right, let me, okay, one more question from Coney. Yes, okay. Coney is asking, which type of screening is more suitable for the elderly? Is it endoscopy or gastroclear?
So that's a good question. In the end, if we are talking about screening, then the question is, why are we screening? Is it because we do have some risk factors? If our patients have symptoms, then typically after evaluation, depending on what the symptoms are, if they are concerning or red flags, the recommendation would still be for a scope, and the doctor can see, if our patient may be suitable to undergo a scope, what the potential risks are, what is the preparation needed before going for a scope. GastroClear is a type of test that we do with using blood tests and essentially trying to understand the risk. And it's there are certainly benefits given that it is not invasive, meaning we do not need to have to undergo sedation or any procedures. It's a blood test, and it can be helpful in trying to understand if there is detecting the risk before obvious symptoms arise, and maybe help to see if the risk might be low or high. And in the end, it is still not a replacement for a scope when it is needed. Yeah, so do discuss with the doctor, depending on what the individual, be it elderly, is intending, or what symptoms they might have. Then your doctor can advise if scopes, going straight for a scope is helpful, or using GastroClear as a way to trying to understand the risk and trying to decide the next steps, whether or not to go on to a scope is useful.
Thank you, Dr. Tan, for your sharing. So just a quick summary from today's sharing. Gastric cancer is not rare in Singapore, so we can take steps to reduce our risks. Early detection saves lives, treatment is available, and awareness is key. So before I end off tonight's session, Dr. Tan, do you have any more information which you would like to share to round up?
I think there were many important questions today, and I do hope that if you have more questions, do feel free to ask, find out more. In the end, arming ourselves with information is the first step to actually knowing ourselves better and how we can manage our risk and how to manage our conditions should we be unwell. And in the end, should you have any symptoms, do seek medical consults, because a lot of times these symptoms can be addressed. We have better understanding of what's happening. And if there's treatment that's needed, we get down to it instead of not understanding and being uncomfortable and potentially having more issues down the road if we ignore symptoms.
So thank you everyone, and thank you Dr. Tan for your informative sharing and answering all our questions from everyone. Thank you so much.
Thank you
So it's
very much, everyone.
so it's now time for Dr. Tan to take a leave. So once again, thank you so much for sharing all your professional insights. Have a good night. All right, so before we close tonight's session, so we would love to get some feedback from you for tonight's session. So we would appreciate if you could take a moment to complete the feedback form for tonight's session. So kindly scan the QR code on the screen with a mobile device or click on the URL link on the comments section to give us your feedback. Thank you for being here tonight on a Saturday evening and for participating. The feedback will actually help us know what we can do differently, what could be done better, and what other topics you would like to learn more about so that we can run these events better for you. And a heads up, our next Facebook Live will be on breast cancer. It will be held on 11 October, 8:30 p.m. right here on our Facebook platform. So please stay tuned. All right. 365 CUPS has been championing early detection, which is why we have introduced a series of free screening campaigns that empower individuals to proactively take steps towards early detection and a healthier future. So we currently have 3 cancer screening campaigns that are currently ongoing: the gastric cancer, lung cancer, and the multi-cancer screening. So you may scan the QR code on the screen or check out our website for more details and registration. So let's encourage our loved ones to take charge of their health and sign up for the screening today. And also, if you are keen to help us bridge the gap and donate to help fund our screening campaigns, please also feel free to take out your phones and scan the QR code. Your donation will help individuals in need have a chance at early detection. All right, before we end tonight's session, please like, share, or follow us on our social media pages for the latest updates on our events. So once again, thank you very much for joining us tonight. I hope to see you all in the next session. Please take care, stay healthy, and good night. See you.